According to the CDC, the baby boomer generation is the first generation where the majority of people will keep their natural teeth over their entire lifetime. Here to tell us more about oral health and having a good smile is Nurse Christina Paris. So thanks for joining us this morning, Christina.
Thanks. Isn't that crazy to think that, I mean, I guess, you know, our parents just always thought that they would grow up and eventually have to get dentures in their older age. So I think it's great that, you know, we have such a focus on oral health.
So why is oral health such an important part of our daily routine?
So our mouth is the first line of defense. You know, when we breathe in, our mouth and nose are what trap, you know, germs and viruses and help clean. And our teeth are very closely related to everything else that goes on. Our teeth have roots, and the roots have blood vessels, and that leads to our system. Our mouth is also very vascular, which is why some medications like nitroglycerin are taken under the tongue. I know there's a sublingual vitamin B12 too, and that's because it's rapidly absorbed that way. We have so much blood vessels. So our mouth is really important.
And then what are some of the effects that oral health can have on us?
So if you're not taking good care of your teeth, like I said, the root system. So if we start to have enamel erosion and it can get down into the root, then you're gonna have problems where it could get into your bloodstream, you know, and when we get cavities that aren't taken care of, or tooth loss, or gum disease, or erosion in our gums, that all is so closely tied to our bloodstream that it can really affect us. Now, when you have diabetes and heart disease and things like that, it can really be exacerbated by poor oral health. We're getting, again, bacteria into our systems. It used to be years ago, and it's kind of controversial, and some still want it, but some people have to actually take antibiotics before getting any kind of teeth work done to prevent any kind of infection getting into their body.
Right, well, I've heard of like taking like antibiotics before, like I've gotten a couple root canals, and like taking that to lessen down the infection.
Correct.
It also does help with the pain and stuff too. But I've heard some like scary stories. I had to get a root canal recently and my tooth was hurting really bad. But right before I was like going in to get the appointment, I read a story about a guy who had a root canal. It went, like the infection went into his blood, and I was like, get me into the dentist now.
Right, exactly, because that's an infection, and it's closely, you know, it's connected to our bloodstream. So when things get in our bloodstream, it can travel everywhere and really cause havoc with our bodies.
So can you recommend some good tips to have good oral health moving forward?
Yeah, absolutely. So the first thing is you want to make sure that you're brushing twice a day. You know, that's the key. Floss regularly. Now, if you're too busy to floss, you don't think about it, getting those flossers for in your car, that works too. So keeping those, maybe flossing when you're waiting at a stoplight, although we're not in a city, so we don't have as many stoplights here, but monitoring your dietary intake. So making sure you're getting enough calcium, you know, that's really tied. Our saliva actually carries calcium and fluoride and can help wash our teeth and clean our mouths. And limit alcohol and soda and tobacco use. You know, we have a lot of mouth cancers due to chronic tobacco use, especially those who use chewing tobacco and it's just sitting right in there. Regular dental checkups. I know Devin and I were talking about this right before we came on about they say at minimum annual. So once a year, but it's really good to go biannual. So go every 6 months, and most of us do that. The sad thing is though, only 1 in 4 people your age actually carry insurance for dental insurance, but it's really important, especially at your age, you know, to keep up those good habits. And then lastly, using fluoride toothpaste, those are really important too. And
I've noticed with the insurance thing, a lot of dentists have a sliding scale too, so it makes it a little easier for people to get in.
Absolutely, they're willing to work with you. I mean, these dentists are healthcare providers who got into it to help people, and so a lot of them will work with you.
Exactly.
And it's especially useful, especially with, you know, this week being a holiday as well. And I know we got a lot of sweets and treats coming up over the next couple weeks. So.
And if you overindulge and for some reason are sick the next day, you actually should rinse your mouth out if you vomit. It keeps that erosion from really eating away at your teeth. Yeah.
Well, thank you so much. We know how important it is to have a good smile, have good teeth here. So hopefully everyone at home is following along with that as well. And again, thank you so much for coming in today. And coming up, we have What's Trending, including the heartfelt reunion between a mama chimpanzee and her baby.
Plus, see which two